Ministry of Health hosts a one-day health fair here at their Brickdam headquarters in recognition of World Cancer Day. They're also promoting cervical cancer. Now, what are some of the services that they're offering here? You could get blood pressure testing, your sugar testing, you could get VIA, pap smear, so many other services if you would like to donate blood as well. All that is happening here. They're promoting the HPV vaccine as well. You know, if you happen to miss out today's event or today's health fair, you can always check the Ministry of Health Facebook page where they would normally give you updates on what's happening.
Most cancers we see in Guyana, or most of the cancers can be, some are preventable, and some, if you pick them up early, they can reduce the morbidity and mortality that can result from them. And so, for example, like cervical cancer is totally preventable if we just take the measures such as the vaccines, get early screening, and then if you do have we pick the cases up early, we can do intervention and you could actually be cured from cervical cancer. In the case of breast cancers, if you pick these cancers up early, we can do interventions and you can actually be cured from it. So cancer, we should not run a diagnosis of cancer. It doesn't mean that it's a death sentence. There are measures, there are interventions that can be done to prevent this long-term or this morbidity and mortality that results from it. So this fair or this Cancer Awareness Month that January just completed, it was Cervical Cancer Awareness Month. And only a week ago we celebrated World Cancer Day. There's a lot of it we need to do. We know there's still more interventions or more programs that we need to put in place if we eliminate and reduce the burden of cancer in Guyana. Cervical cancer is the one that we identify for elimination. We have a very ambitious target by 2030 that we should be able to be on the road of elimination of cervical cancer, which is totally preventable and can be done. In the same cases with breast cancer among the women and the prostate cancer in our male population. So we have a lot of work to do. One of the things is to get the message out and get people to come to get screened. We are now soon we will be launching our national cancer control plan that will cover these 5 cancers that we are focusing on, and hope that we can get a handle on it and so reduce the burden of cancer in Guyana. And so with these few words, I just wanted to encourage our staff. At least we know, I think the ministry have about over 80% female staff. So we would encourage you to get breast cancer screening done, get your cervical cancer screening done. For those who have never had the HPV vaccination, which we'll be rolling out soon for prevention of cervical cancer, can be done up to 26 years old. So you can there's still a chance that you can get your vaccine, ensure that you get, and not only you, but spread the message to all and those that are, in your family, your relatives, encourage them to come and get screened. Be expanding the screening facilities throughout the country. At least every region or every major district hospital and regional hospital would have the ability to screen for breast, cervical cancer, and prostate cancer. So we wanted to close that gap. There's still a lot more work to do, but at least we need to start. Screening is very important. And so we hope that with this World Cancer Day message and also the Cervical Cancer Awareness Month that we did pass, that some of this message gets out to the public and so that we can see people who are coming forward to get themselves screened. Thank you.
Honourable Minister of Health, Dr. Frank Anthony, CMO Dr. Narayan Singh, Director of Non-Communicable Diseases, Dr. Lachmi Lal, Coordinator, Dr. Pinelli's report. Friends, colleagues, program directors, the media, a pleasant good morning. So as we close the gap, we want to unite our voices and work together, take action. And with the existing teams, together we challenge those in power. We have seen the demand to prioritize and invest in cancer prevention. And this has been demonstrated in our 2024 budget projections. So let's work together to raise awareness, to fight cancer, to create a peaceful and healthier and possibly cancer-free environment. We will now invite our Honourable Minister of Health, Dr. Frank Anthony, to give his remarks.
Dr. Lal and team, directors of the ministry, CMO, members of the staff. I think you've heard from the two previous speakers telling you about some of the things and the reason why we are holding this day. So what I want to do is probably to re-emphasize a few things that they've spoken about, just to put that context, because I think it's important where we are today to be able to do that. We have started over the last couple of years to look more closely at chronic non-communicable diseases, and I think we have a pathway of how we are going to reduce diabetes, what we're doing for hypertension and other cardiac diseases. And we now want to turn our attention to cancer. As you heard, the three most prevalent cancer in our society are breast, cervical, and of course prostate in men. And when we actually look at the latest report in terms of mortality, prostate cancer, more people die from prostate cancer than the other cancers. And therefore, this is something that we have to pay attention to. Now, these are not the only three cancers, but we want to have a focus on these three. In terms of breast cancer, one of the things that we've been doing, we have a lot of awareness around breast cancer. But when we make people aware that such a cancer exists, we have to provide a service. And as a ministry, we have to be able to provide that service so people can come to us and get service. So one of the things that we have is mammograms, and we're able to do that at Georgetown Hospital. And our intention is that during this year, we'll add 3 additional mammogram machines, one in Linden, one at Brickdam, and one in Amsterdam. And so we will be able to give more women access so that they can do mammograms. We have also been able to come up with guidelines and so forth, and we'll be implementing these. Another very important milestone that we have in terms of breast cancer, when you do a mammogram, it's a crude way of saying that maybe you have these lumps, then we have to do a fine needle biopsy to determine whether the tissue is cancerous or not. And for a long time, when you send the fine needle biopsy to our lab, sometimes it took at least 3 months to get back results. In the meantime, people are anxious, they don't know whether it's cancerous or not, and therefore we wanted to change that. With our new pathology lab that we just opened, you can get back results within 24 hours to 4 days. That's the turnaround time now. And in addition to that turnaround time, what we've been able to do is to do a number of histochemistry markers. So a lot of differentiation between different types of cancer. We'll be able to do that with our new pathology lab because they have all the equipment to be able to do this. And so that would make a significant improvement in making a more accurate diagnosis of cancer, especially breast cancer. When we come to cervical cancer, over the last couple of months, we've spent some time to do a very comprehensive program as it relates to cervical cancer. We want to look at the preventative aspect, and as CMO was saying, we are going after the WHO targets of 90, 70, 90, meaning that we want 90% coverage of children between 9 and 15 getting the HPV vaccine, and we want to even go beyond that, where all the age groups, let's say between 16 to 25, 26 to 45, that we can also give them HPV vaccination. Because the new guidelines are pointing that if you vaccinate people, regardless of this early age group, you can vaccinate them later, and it would help in protecting them against cervical cancer. So this year we'll be aggressively rolling out that program to make sure that more people can have access to this vaccine. The second important thing that we'll be doing is screening. The WHO is saying that 70% of eligible women should be screened. Traditionally, we have been using pap smears, we have been using VIA, but we want to also add to pap smears and VIA, we want to add HPV tests. These tests right now, they're quite expensive. They cost maybe about $25,000 in the private sector, but we are going to offer it to people free of cost. And one way that we're going to do that is to give them a voucher. So those who are eligible, they'll be given a voucher by the ministry and they can go and do the tests in the private sector. We are also upgrading our labs to make sure that we also would be able to provide this service for people. So that's another thing that we roll out. And I'm very hopeful that once we roll this out in a very aggressive way, that very soon we too will be able to meet that 70% of eligible women being screened. The third thing that we are looking at is those who have been diagnosed with a cancer, to be able to put them on treatment. Right now, a lot of the treatment we do would be surgical. So we are able to, if they have metastasis and so forth, we're able to deal with that surgically. But if we have to do brachytherapy, it's not available in Guyana. So that's a gap in the treatment that we can provide. Very often, we would help to subsidize these patients to send them abroad, but that's not a very sustainable thing to do. And so this year, we are working to introduce brachytherapy in Guyana. So we'll start the process and hopefully we can get brachytherapy introduced here in Guyana. So when we talk about cancers in women, breast and cervical cancer, we are taking definitive steps to improve how we diagnose and treat these types of cancers. In addition to this, for men with prostate cancer, we'll start a program this year looking at how we can roll out a comprehensive program. Men are a little bit more difficult to work with because a lot of men don't come to clinic. And very often they might have signs and symptoms of enlargement of prostate, and which then maybe later you can get prostate cancer. But they tend to ignore these signs. Only when it's really dominant, then they'll come to the clinic, by which time they might have a lot of other complications. So we want to start an awareness program of getting men to understand the importance of getting screening early. And we'll be offering PSAs free of cost so that people can come in and do those screening, and then have a comprehensive program. If we detect any cancer, what we can do. So as we mark this day, signifying awareness or raising awareness of cancer globally, and the theme is very apt because you want to close that gap. And we are taking concrete steps to be able to close the gap between not just being able to diagnose cancer, but also being able to treat cancer and thereby saving a lot of people. So I think I want to express my gratitude to all the different people in the ministry who have been working on these programs, enlarging them, making sure that we have a comprehensive program. This is not just one department. A lot of these things we have to combine our efforts, and it has to be spread across different departments. So while we work as a team in the ministry, we also have to get a lot of stakeholders to work with us. And we've already started doing some of that, bringing in different NGOs and community stakeholders and talking to them, educating them, and hopefully through their connections, they'll give us greater reach so that we can be successful at helping persons to prevent cancer in women and cancer in men. So with those few words, I see the sun is affecting some of you in the front row. I will just want to declare this mini fair open. Thank you very much.